my presentation today would be about, continue with Dr. Tenenbaum about fetal alcohol syndrome, but I'm going to go more in depth and talk about intervention, what to do with them. Okay, we have the kids, yes, we know that we have it, we know we heard from Orna all about the children, the problem with the parents, the problem with the children, but the kids are there, and what are we going to do with them, and how are we going to treat them, and what are we going to how are we going to deal them with love and compassion and nurture, and knowing that we bring all the problem, and knowing the kids are bringing all the problem, and how to put these whole things together to create a healthy human being in our society, which will keep us going more, right? Because we really, while we're here, we really want to keep our generation going up so we can really have our rest. So I just want to let you know how about I got to this field and how I'm still struggling with intervention. In 1985, I started to work in a program called Head Start, which is a federal funded program in LA, in the United States. I was back then talking about stigma. I was back then the handicap coordinator, which today is the disability/mental health. One of our issues was to really test the children twice a year, and we used, I don't know how much you're familiar with the Denver Developmental Screening Test, which did test cognitive ability, language, and so forth. And so I tested those children, and one day they were fantastic. They did everything. They were real enthusiastic. The next day the teacher calls me and tells me, you know what, Irit, we have a problem. The kids are not paying attention. They are not there. What are we going to do with them? Or they're forgetful, or they're very aggressive, and then one day they were very good, and so forth and so on, and we heard this complaint, and the complaint was really about the non-consistency of the children's behavior, forgetfulness, aggressiveness, and so forth and so on. And due to the fact that most of the kids with diagnosis back then, the children with Downs, it's the CP kids, they got services. Those particular kids did not receive no services. And back then I just finished my master, and I said to myself, you know what, this is the group of people I want to devote my life, because really this is a group of kids who nobody really pay attention. They are really fall behind, and nobody really look forward, and nobody knows what to do. So I wrote a grant to a recovery center and a rehabilitation center for women and children to work with a dyadic mother and child, and really to talk about prevention, how to really help in prevention, how to really help those children with alcohol syndrome, with, and they're not just alcohol, because when we talk about alcohol, and I'm going to talk more about it in a few minutes, is the fact that they are, sometimes we're really not sure they're just alcohol. We don't know what kind of drugs. We don't know what age, and in the pregnancy, when did she use the drugs? What did she use the drugs? Was it a rape baby? We have to have so many issues before we get the baby. But before I'm starting, I want to show you a clip. Can we go back to the clip, please? Yeah. Okay. Okay. And I really want to specialize it, because when we talk about fetal alcohol syndrome, we talk about the facial, and I really want to show you that some of the kids that come to us do not have the facial features that we really see.
There was a secret chord, David played to please the Lord, but you don't really care.
Ready? Short?
Well, it goes like this, the fourth, the fifth. My fault, we left the baffled king composing hallelujah.
I will pick up when we to
Hallelujah, hallelujah, hallelujah.
This is my working kid.
It's not your cry.
I could help you lost.
It's not someone who's seen a light. It's a chord and it's a broken hallelujah.
Damage to my central nervous system.
Hallelujah. Hallelujah.
The actor fall a lot. No time or not. Just say.
So I just wanted to show you that when we see those children, and we see with the facial, not all the kids with fetal alcohol, like Dr. Tenenbaum shows, have the facial, and that's when we are talking about adoptive families, that all of a sudden they're getting those children, they do not have the facial, and they're showing all the different behavior, and then the question is what and how to do it. So when we are talking about so Dr. Tenenbaum talked about the spectrum disorder, which I'm going to skip it, and we know that 94% are having mental disorder. And this is the only mental disorder we know for fact we can prevent. And it's a very important fact. I think so. Also, fetal alcohol syndrome they have behavior problem, and then another thing that I want to mention, it's important that it's all racial and it's all socioeconomic groups. So it's not just with at-risk children or it's not high-risk children, it's all socioeconomic groups. So when we're talking about adoption, because this is really the group of people that we are planning this talk, is really understanding that the kids are from all level of economic status. The most important thing before, and we were talking about intervention, is really, the first thing is really to really understanding what the signs, and I'm going to kind of make it a little bit faster, what is the challenges in the early identification. Because we have to know that early identification is very, very important. As early as the child is, it can have the services are more important. So children's FASD may develop secondary symptoms. The primary symptom, and really we have to understand this, and this is a very important thing, the primary reason the child has, it's the effect of the alcohol, the effect of any attachment, it's have the effect of the mother during the pregnancy, on all kind of outside factors, genetic factors. So when the kids come to us, we are seeing the secondary effect. And now we have to deal really with the secondary effect, which are the fatigue, the tantrum, the frustration, the irritability, the anger, the aggression, the fear, the anxiety, the trouble at home and school, the isolation, the mental health problem. And this is really a lot of problem that we as mental health professionals are getting all the problem, and then we're getting the secondary, and usually we tend to really treat the secondary with, and when we really have to understand that we have to really look at what is the primary, which is really mimic the, where is it? Go back, the ADHD, because we said that a lot of kids with fetal alcohol syndrome, we might give them medication because we think that they're having ADHD. And when we're talking about ADHD, we know that ADHD have difficult focusing and sustaining attention, and children with fetal alcohol syndrome have problem with shifting attention. So it's very important to understand that sometimes when we're giving the medication, because we think that they cannot sit still, because they cannot focus, because they cannot control themselves. We give them the medication, but it doesn't help, and we didn't understand why it doesn't help, because again, we're talking about secondary problem and not primary problem. I'm going to see. I think I really want to focus a little bit more about it. So when we see kids with fetal alcohol syndrome, I really want you to really understand that through lifespan, how can we identify the kids, and how we really need to pay attention when we work with kids, even if it's adoptive families or not adoptive family, how to really identify and through lifespan to see red flags. What are the really red flags for each group? So we know that with infants that have low birth weight, irritability, sensitivity, they have problem to sound, to touch, they have problem to noises, they have poor sucking, and the poor sucking is because, as you remember from Dr. Tenenbaum previous slide, is because of their lips. So they have poor sucking, and so they have poor speech, and they have a lot of issue with, because of the dysmorphic facial problem, which problematic with them. When we get to the preschool, the toddler, all of a sudden, as I mentioned to you, that sometimes they remember it, sometimes they forget, they have poor memory capability, the hyperactivity, the lack of fear. They can jump on you, they can run to you, they have no fear of stranger, which sometimes this can be also when we talk about attachment, like, we can call it a disorganized attachment because we have nobody there for them. So again, it's like, they have no sense of boundaries. And so when a preschool kids run to you, happy, 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 and they love you and they never saw you before, it's a red flag because it doesn't know you. And we know that it is really discriminatory attachment. We go to the grade school, the short attention span, the poor coordination. We see older children trouble keeping with school, low self-esteem, from recognizing they are different from their peers, and the teenager, poor impulse control, cannot distinguish between public and private behavior. So let's see that the parent is adopting a child, and she's adopting a child, and the child is an infant, and she's going to the doctor, and the doctor is a low birth defect, it's irritability, sensitive, and sometimes she goes to the doctor, and you know what the doctor tells her? You're going to outgrow it, absolutely. You're going to outgrow it, no problem. So she's adoptive mother, right? I'm adoptive mother, and it's happened, and I see it again and again and again. She's adopting the child brings all the symptoms. She have the child, now she have all the guilt. Orna told you all about her issues, right? She has issue. I want to adopt, I don't want to adopt, I want to adopt a perfect child. Now I have this infant has all the problem. I bring my problem. The doctor says it's outgrow, but it doesn't grow. It doesn't go away. It doesn't go away. I'm getting more fearful. Now I'm developing guilt. No, I'm not a good mother. No, I should not have the child. No, so now it's another factor coming because I'm an adoptive mother. The child, I don't know that the child has what it's having, because I know that it's not thriving as I wanted him to be. The doctor tells me he will outgrow it, no problem, and then the cycle begins. Or I know kids who've been adopted, usually a toddler or at grade school, and they all of a sudden having tantrum, and their mother have no, sometimes and we have some cases like this that the mothers wanted to take back the child, and the case was the kids from Russia, and they bring to take back the adoptive child to Russia because the problem. So I have 5 more minutes. I want to really strengths about the strengths, because we always talk about what the child is not with FASD is not doing good, and I really want to highlight the strengths because I believe I like to work with the strengths. I think what strengths the child have, and I feel that if the child, some of the children are highly verbal, bright, artistic, athletic, friendly, determined, willing, helpful, generous, and good with younger children. So we really have to build our curriculum about the strategies with intervention. I think that I really want to highlight, because we talk about adoptive and fostering, so with working, we really have to really understand the parents before the parents adopting a child and understanding why they're adopting, and discuss the child's background with the social worker, ask for information, and support the child as much as possible, and do a lot of parenting groups. Parenting, and parenting support, because the parents really don't know what to do with the child. The child usually is all over the place. They don't know how to deal with it. They don't know how to behave with them and how to deal with them. I have here, it's 2 minutes slide, which I feel that it's an intervention.
Started seeing a lot of hyperactivity.
And that's an intervention with child with a fetal alcohol
Started
syndrome.
getting a little concerned when we first saw the developmental pediatrician. He suspected that there was an underlying syndrome due to fetal alcohol exposure. The diagnosis gives you some validation. We can say this is a disability that is a result of a birth defect. Living with a child with fetal alcohol syndrome is like living with a constant anticipation of a hurricane. Over time, you understand on so many different levels how this impacts not only your child, but your family. It's very hard to be a sibling of a child with fetal alcohol spectrum disorders. It's hard as a parent not to put this burden on your typical kid, because it's like you want to say, you're the easy one, don't act out. We know there is no magic bullet. There is no one thing that is going to change everything. Having some OT and speech and physical therapy certainly help. And we want to try to teach social skills to your child. But I think the intervention that I am most excited about is that we obtained a service dog. Ayal has an unconditional companion. One of the things we've learned as parents is that you want to try to create external supports for your child so that they can feel successful in any environment possible. The earlier you have a diagnosis, you can start intervention. If you see some behaviors in your kids that might look like what I'm describing, you certainly would want to make sure that you have a pediatrician examine your child. And if you're not hearing things that feel intuitively like they're answering your questions or your concerns, that you go to some sort of specialist, either a child neurologist or a developmental pediatrician. You have to look at this in the face so that you can help your child. I think it's important to tell the truth, to talk about what this is, and not to be ashamed, because if you're going to teach your child to be an advocate for themselves, you have to say, this is my kid. Part of my kid is that he has a disability, a profound disability. Every parent wants their child to be happy, and certainly that's what we want for Ayal. I think finding happiness within the context of this disability is going to depend a lot on Ayal feeling safe. Because he's so vulnerable, it is going to be our lifelong job to keep him protected and safe. There are points in the storm. You just have to look for them.
So I wanted to give you a little bit of intervention that had been done, and I thought that this movie will really explain more about the mother, the struggle that she's going, and how, in different intervention, that she found out that the dog would be a very good resource to help the child. I want to finish by sharing, I have a lot of information here. So if you guys, if somebody wants this information, it's like, I want just to get to the last, it's very artistic. Sorry. All right. Okay, I want to finish with this, and really want to stress upon the fact that when we work with a child, we don't want to see what the child won't do. We don't want to stigmatize the child as bad, annoying, lazy, unmotivated, lying, pushy, acting young, baby, trying all this. We don't want to do it. we really want to stress upon the fact to understand the child that he cannot do it. It's not because you don't want to do it, because he cannot do it. And he's frustrated, and he's challenged, and he's really trying hard because he has some disability. And he's really trying hard, and he's not lazy. And he's not, and sometimes, yes, he's oversensitive. And yes, he's needing contact to support. And yes, and we have to really install the hope with him and the understanding and the organizing it. Because if we are feeling that we are feeling hopeless and fear and chaos and confusion, we feel the same thing what the child feels. And if the child feels so frustrated, so lost, so unconnected, and as a parent you feel the same way, and a caregiver, you give the child the justification that something is wrong with him, instead of really finding the strengths and really helping him to understand and giving him tools to help him in his life to become the person that he wants to be. Thank you very much.